Hi, I'm Dr. Jack West. I'm Associate Clinical Professor in Medical Oncology at the City of Hope Comprehensive Cancer Center, and also the founder and president of GRACE, Global Resource for Advancing Cancer Education. I'm very happy to be joined today for an ASCO highlights presentation in the field of lung cancer with two of my friends and colleagues from other parts of the country who are lung cancer experts with some different perspectives, and we're going to go through some of the key presentations and talk about what we think this means for patients. First, I have Dr. Helena A, who is medical oncologist at Memorial Sloan Kettering Cancer Center, and Dr. David Spigel, who is Chief Scientific Officer and Director of the Lung Cancer Program at the Sarah Cannon Cancer Center in Nashville, Tennessee. Thanks, guys, for joining. There were several studies presented in the setting of extensive stage small cell lung cancer. So 2/3 of patients have metastatic disease in the setting of small cell. It tends to spread relatively early in its course. And these studies that were presented gave a combination of chemotherapy with or without other checkpoint inhibitors. We already have 2 agents that are FDA approved after demonstrating a survival benefit given with chemotherapy in this setting of first-line treatment for extensive stage small cell. Both Tecentriq, atezolizumab, and Imfinzi, durvalumab, have already shown that in previously reported and presented studies and been FDA approved. So we have 2 options and only can use one. Now there's a couple more that have been presented. See a significant improvement in progression-free survival with Opdivo, nivolumab, no overall survival data presented. And Keytruda, pembrolizumab, depending on the way the analysis was done and who was included, borderline significant for overall survival. And so my question is pretty simple here, and that is, are these studies adding anything at this point? Are they just too little too late, or do you see any path to their utility alongside or instead of what we already have? David?
Yeah, I think they all look about the same. I think Nivo, unfortunately, if I remember, this is a phase 2 study, the Pembro, so Nivo is not really able to get registered in that way. But I think you're right. I mean, when you look at Caspian with durvalumab added to chemo and Empower 133 where atezo is added to chemotherapy, I don't think there's anything new here, or is there anything new with those 2 studies? I mean, I think what we know is that adding immunotherapy, probably regardless of agent, to platinum doublet chemotherapy and first-line small cell extensive stage looks to all be about the same in terms of efficacy and safety. So I think it's just another tool or another couple of tools in our toolbox, but I don't really see any real advances here otherwise.
Helena, are these just a lateral move at best or anything better?
Yeah, I think just lateral, like you said. I think it just, again, reinforces a small but real benefit with adding immunotherapy to the chemotherapy backbone for small cell. And I think maybe perhaps allows for sort of other combination studies to be done, but not really additive or practice changing in and of themselves, these new agents.
Great, thank you.